As the Kenyan economy slows, Kenyans are being encouraged to adopt strict saving culture. And one way that we can ensure this is to make sure we prioritize. What are your priorities? Is it health? Is it luxury? Or what is it? And speaking about health, you know, there's so many solutions that have come up to ensure that more and more Kenyans are caring about their health. And one of them happens to be the digital solution. Some of us have heard about M-TIBA, but we probably do not understand what it is. So to help us take care of this unknown solution, we are joined by the Chief Executive Officer for CarePay Limited, that is Kees Van Lede, who actually is the brain behind M-TIBA here in Kenya today. Thank you so much for joining us.
Thank you, Joy. Thanks for having me.
For everybody who doesn't quite understand how M-TIBA works, what is the simplest way you would explain it to us?
The simplest way of explaining it is MTIBA is like MPESA for healthcare. So basically it's a wallet on your mobile phone where you can lock some money in, either yourself or you can send money to someone else's MTIBA account. And that money that sits in your MTIBA account you can spend at registered healthcare facilities across the country. So basically it's a way to help you save or send money in a simple way that you can dedicate for healthcare.
All right. And speaking of healthcare, while we might not have a very good saving culture, we actually have one of the most admired, mobile money transfer, cultures here in Kenya. True. And Kenya happens to be one of the top countries when it comes to use of mobile money transfers. How exactly can we harness this same culture, and transfer the same towards saving for health?
That's a great question. It's exactly why we started MTIBA in Kenya, not somewhere else. M-PESA is credited for the financial inclusion gains that Kenya has made. A few years ago, about 10 years ago, when M-PESA was launched, hardly any Kenyans in the lower income groups would have bank accounts. Right now, you see almost everyone in the population transferring digitally. And what we actually stand for is healthcare inclusion. So we raise the bar from financial inclusion now to healthcare inclusion. And what that means for us is that people all across Kenya, all across all income groups, shouldn't be worried about how to pay for healthcare and that they should get decent quality of healthcare. That is what MTIBA stands for. So the reason that we started in Kenya is because that infrastructure is already there. So it's relatively easy to build this new service on top of something that is already reaching all Kenyans.
All right. So how different is this platform, say, from health insurance, the ordinary health insurance that we have in Kenya today? Because I guess the question would be, if these health insurance, why should I still subscribe to MTIBA?
Well, the difference is for now, indeed, that we've launched with a savings product. And the key reason is that insurance still has quite some misconceptions and sometimes also bad reputation. So if you look at the number of people that actually have insurance, it's about 2% of the population, if we exclude NHIF. So the vast majority is not familiar with the product yet. So what we thought was a much better approach is to start with getting people from paying, or at least stressing about paying when you need it the most, when you go to the hospital, you seek care and you don't have the money in your pocket, and try to get them to start planning for those expenses. And that is a savings culture. A logical next step for us is to then bridge it and to also start offering simple insurance products, because I think the insurance industry, not only in Kenya but in general, hasn't been very successful in making simple to understand products. That is for us the next phase that we want to go to. But we first thought, let's start with something easy to understand, something that people already do, and then take them to the next step.
All right, and tell us about your subscriptions at the moment. How many Kenyans are subscribing to the MTIBA service?
Actually, yesterday we had a big celebration in our office because we reached the 200,000 users milestone.
Wow.
We have launched the service at very small scale still, only in one area in Nairobi, end of June last year. So we've been very silent. Actually, a lot of people didn't hear about us maybe until end of last year when we started to do real radio campaigns. And in the month of December, we actually grew by 50%. So actually the numbers are growing really really, really fast, which is a good sign. And it's not only people who are enrolled by our agents, so we have people in the field, but more and more people start to self-register, which is very easy. You dial *253# and you can do it yourself.
All right.
Yeah.
All right. And in regard to that, you say you've just hit the 200,000 mark.
Yeah.
Are you able to categorize who exactly these people are? Are they low-income earners? Are they middle income? Or are they the A-class that we're looking at?
Well, interestingly, we see all of those. Obviously, our main focus is on the people who don't have insurance yet. But as I already mentioned, if you look at real comprehensive health insurance, that's still 98% of the population. So you could argue almost everyone.
Yeah.
I think everyone who's not insured can benefit from MTIBA. But even the people who you call the A-class, people who might have insurance from their employer could benefit. Because through MTIBA you can also send money to someone else. So while you might have a rich package from your employer, you are very likely to support people up country, or your staff, or whatever the people may be. And there MTIBA is a great solution again.
All right. Is this model unique to Kenya, or it's worked somewhere else around the world, and so we're only playing catch-up?
No, you're actually the first. As far as we know, I can't claim to know all the healthcare products out there in the world. But as far as we know, there's no combination of a mobile money landscape that is so active, where so many people are already financially included, as we called it, combined with such a innovative medical platform. So I think, obviously, if it's up to us, we can prove again, like Kenya was able with mobile money, we can prove again that Kenya is a front runner in digital services.
All right. In terms of value addition, as you look into 2017, times are getting tougher economically for most people. And so when they're putting out their money, they always want value for it. What does 2017 look like for CarePay?
Well, actually already people who put in money in MTIBA get rewarded through cash incentives. So every 100 shilling you put in any given month, you get the 50 bob bonus on the spot. But we're going to start offering different solutions. I will tell you more about the details, but as I told you, the strategy is definitely to go towards insurance. We know that insurance is a better way to prepare yourself for financial shocks than savings. But like I told you, it's also something that people have to grow into, in a sense. So that will definitely be the space that we want to get active in the course of this year.
All right. Well, thank you so much for joining us on this edition of Business Today. We've been speaking to the Chief Executive Officer for CarePay, that is Kees Van Lede, and he was talking to us about the latest digital solution for your health. So how exactly do you want to make value, or at least have value for your money? One way to look at it is to save for your health. Away from that,